I was just listening to Bernie Sanders talking on the Tim Dillon podcast, and he was talking about how the Canadian healthcare system is superior to the American just because we don't pay. So when you go to the hospital and you come out, you don't owe anything. That's not necessarily true either. Like, there are some situations, like say you break your leg and you need to pay for a cast or something, right? But for the most part, yeah, we don't have to pay anything, but you also don't really get anything out of it either. Like, if you actually have a real severe issue going on, good luck getting a doctor who can help you, because you'll be put on wait lists that will be a couple of years that you're waiting just to see one specialist for something. My girlfriend suffers from a rare genetic disorder called Muir-Torre, and she is ill constantly. She can't have a job right now. She can't do much of anything. She's very ill, and every time when she has to go to the hospital, when it gets really bad, the doctors kind of just do a few tests, the basic tests. They don't do anything extensive because the Canadian healthcare system is always trying to save money, right? So you're not paying for it, so they aren't going to do the extensive tests there. They're going to make you have to see a specialist before deciding to do any of that. And to get a specialist, you're, like I said, waiting at least 18 months to see somebody, just for the most basic. And good luck finding a doctor as well. So if you come here and you're needing a doctor, you'll be on a wait list for several years just to get a doctor. Her doctor's absolutely horrible. He's prescribed her medications for all the time that she wasn't supposed to be on for a very long period of time, and kept her on for an entire year. That messed her up more. And the doctors, they screw up so often, but it's not a big deal because they can't be sued here, right? So it's not at all as glorious as they try to make it sound, right? A lot of the times we're willing to just pay to get in somewhere quicker and have someone do their due diligence to do what's necessary to help the person, right? And there's no perfect healthcare system. I don't think either or is perfect. I don't think a paid healthcare system, private entirely, is perfect. And I don't think that a government funded and subsidized is entirely perfect. I think that there should be both within the country. You should have the option to go to private if you want, if you're dealing with a very bad crisis that you want resolved right away, and you need people to do the best they possibly can, and you have the money, then you can alleviate some of that pressure off the subsidized system as well, right? There's a lot of people in this country that can afford to go to private healthcare, which would alleviate a lot of pressure off of our subsidized doctors and our subsidized healthcare system. So I don't think either or is the best way to go, but it's definitely not, we're not the end all be all. So the statement he's making it's not entirely accurate.